because this is one of the problems we have with the day-to-day work. Skeletal injuries are one of the most common causes for children to be taken to the emergency room. Usually, if you have a fall, if the child falls, or if there's any kind of trauma, go and do an x-ray. But who looks at these x-rays? Most likely, it won't be a specified pediatric radiologist. It could be anybody. So the fractures in children are much different than the fractures in adults. Okay. Children, the most common causes of children coming to the emergency room are falls, some kind of trauma. If there's any trauma, suspected fractures, they take x-rays. Okay, who examines these x-rays? Not necessarily a pediatric radiologist who sees children's bones regularly. It could be anybody. So any other clinician. So this can cause confusion, okay? Okay. The bones of children are very different than the bones of adults. And fractures, they have even specific fractures related to childhood, which are not in adults. And these, there even cannot be a fracture. It could be bending, as we can see. And then there's also growth plates, metaphysis, epiphysis, apophysis, which are not present in adults. So this can cause a confusion, okay? And as well, if these fractures are not seen to and not diagnosed and not treated properly, it can cause long-term trouble, like shortening of a limb or loss of mobility, okay? In Europe, there's 14 deep learning algorithms for fracture assessment. But out of these 14, only 4 are for children, okay? And these 4 are, it seems like their sample size and thing is not that good, okay? So what does AI have to overcome in pediatric traumatology, okay? That children's bones are different than adults. They're more flexible, so the fractures look much different. Epiphysis and apophysis may be mistaken for either an avulsion, or metaphysis could be mistaken for a fracture line. So this is not only AI's trouble, this is the radiology's trouble, okay? And then sometimes fractures are so fine that you see indirect signs like effusion and raising of the fat around the joint. Okay, this is just a little reminder what these fractures look like, the specific fractures to children. Buccal fracture. This is usually caused by in the upper limbs falling on an outstretched hand. The child falls and puts his hand out to break his fall. This is when the bone bends on each other, like here. You will see a little bit outpouch. Now this in children is a fracture. In adults, it's not a fracture at all. Here, even this one is not apparent on the AP, it's just apparent on the lateral view. Then there's bowing fracture and green streak fracture. These two are related because a green streak fracture is a severe type of bowing fracture. Bowing fracture means the bone just bends. It doesn't, because the bones are soft, they bend. So it bends. Then if further force is put on it, it fractures on one side of the cortex and not the other. As we see here, look. One side of the cortex is interrupted and the other side isn't. And there's bowing here, as we see. Here again, and this one has bowing, and this is just bowing. So this is a great confusion. Salter-Harris, epiphysis and metaphysis. This is the epiphysis and metaphysis, because it's a growing area, it's weak. And this is where, as well, these are very important for the growing children, if a fracture happens here, it can cause shortening of the limb. These are the different fractures. Either the fracture goes right through the metaphysis, or below the metaphysis, above and below, or the metaphysis becomes squished from the fracture. Okay? Another confusion is the ossific centers. Are these ossific centers, especially, there's great trouble around the elbow and at the base of the fifth metatarsal. This is the insertion of the tendus apophysis. There's a fracture in adults that appears like this. So the AI gets confused with this, okay? And as you see as well, in children, these are all ranges. You know, it shows at 10 years, 12 years, and then it closes 2 to 4 years. When do we know, is it closed, is it fracture, and this kind of stuff. So can you see the possible potential confusion? Okay. How is AI, how is the performance of AI? Okay, it's because they're different softwares. AI is there's 4 different softwares, there's different accuracy. They are all around the 80 to 90 in sensitivity and a higher bit of specificity, okay? But AI is improving day by day. So these numbers are not static, they improve. With more learning of the AI, more software updates, these become better and better and better. However, looking at the research, anybody who does research, they only do research on a single type of software. They don't compare the different softwares. So for people looking to get AI, which software is better? There needs to be studies about that, okay? And many of these studies have small amount of patients, okay? And they only involve the appendicular skeleton, legs and arms, which, I mean, ribs. I mean, if you ask me, ribs, and we need help with ribs more than we need help with rests. There's certain things that are very difficult to see. AI should be helping us, okay? What's the main pitfalls that AI, what's the problem with AI? Where do they fall short? With the bowing fractures, they miss it, okay? But these are difficult for even the experienced radiologists. Apophysis of the fifth metatarsal, that's a lot. And that is a common mistake by inexperienced radiologists as well. And detection of fractures around the elbow, that is a big problem with AI as well, okay? Here, this is a paper which showed the different problem areas. They said this is medical legal. Why? Around the elbow and these specific fractures here will bother the growing end of the bone. And if they're not treated properly, right after fracture, treated properly and these will lead to shortening or limitation of movement. And as you see, like this one, the very fine line, I mean, you know, even for experienced radiologists, it's very difficult. But here, this is well seen, and it goes straight through the metaphysis. Okay? False positives. They give false positives and false negatives. These are pictures of the AI annotated images. It depends. Each software has different ways of marking out their problem areas. Here, it's the fifth metatarsal, the apophysis, okay, that hasn't fused. Here, it's in red. That's one software, as we see by the paper. And then this is another one, Bone View software as well. But with this software, they have question marks. If it's a question mark, then the AI isn't sure. It's query, possibly. So AI wants the radiologist to have a second look. Instead of AI could be a second pair of eyes for the radiologist. Here they want us a second pair of eyes. This is another example about around the wrist. As you see, these are images here, plain the X-rays first, and then afterwards they're annotated. They say fracture. Okay, sorry. Okay. You can see here they said fracture here, and they said it was a fracture here, and they weren't correct. Some were correct and some weren't. This is a bit of a scheme here. It shows how AI should help us. When you look, AI will, a radiologist will see, and they'll say, oh, it's so many % right. Sometimes AI will look at an image, they'll give you, like the one before, the question mark. It may help you to further diagnose it, but sometimes it confuses you. So if you weren't right, it will confuse you, you were right, and you did a wrong answer. So the next, it's a valuable tool to help radiologists, okay, as a second pair of eyes. And it can also be done for training of radiology or other people, other clinicians. Okay? Thank you.
شكرا يا دكتورة ليلى على المحاضرة اللطيفة ديت، وننتقل